Hi everyone, welcome back to my channel. My name is Jamie Canada. I am a pelvic floor physical therapist, and today I am so excited to be talking about hygiene for your vulva / vagina, and is it necessary? One of the biggest questions I'm asked is, should I be cleaning my vulva or vagina? And the answer to that is not necessarily. Definitely medically, it requires very little, if any, cleaning. We'll talk about more of the vulva first, specifically, which is going to be that external area. Any cleaning that goes on is typically just due to preference. This preference typically comes from the odors that we may experience, which could be menstruation, ejaculation, or medical creams, and so on. So typically, if you are someone who is feeling self-conscious because of these scents or they're bothersome, then it's okay if you're doing it correctly. I will say, if you do struggle with urinary or fecal incontinence, cleaning is going to be a little more important because you don't want bacteria to build up in that area. What typically happens with those that do have pretty severe urinary or fecal incontinence is it starts to kind of destroy the acidic mantle of that skin, which can lead to skin irritation and breakdown. So where exactly would we wash? So you don't want to wash anywhere within the labia minora. So those are going to be the tissue that kind of, for some, hang down a little bit. So you want to just do everything from labia minora outward. So these are going to be like these smaller lips, if you will, because we do want to avoid getting into the vaginal opening and area, which we'll talk a little bit more in a few moments. And if you're going to be washing the vulvar area, avoiding anything in between there, you want to stick with a gentle cleanser and one that avoids any fragrance. Water is always a safe option as well. It doesn't necessarily have to be a cleaning product. For me, I've shared with patients before, like even using a bidet or in the shower with the handle, just to give everything a little bit of a rinse down there. It can also be very effective without putting any soaps that could mess with your vaginal pH. If you do choose to use product like a gentle soap, then the areas that it is safe to use is going to be the groin, labia majora, so outward from the inner lips, the mons, so if you think about kind of the top area where your pubic bone is, as well as the anus. When looking for products to use, you do want to think about the pH. Vulvar skin is around 5.3 to 5.6 pH. A lot of soaps tend to be higher, which could increase pH to 10 plus. So looking for like a gentle cleanser is going to be preferred. And as I mentioned, you don't want to use soap internally ever, and avoid anything with fragrance if you can. Some products I recommend that maintain pH of 5 to 7 are going to be Cetaphil, Restoraderm, and then Eucerin, a gentle hydrating cleanser, or the Eucerin pH 5 cleansing bar. I know that wipes are promoted all over as well. Consider using a bidet or washcloth because you don't want excessive use, because that can lead to contact dermatitis and also lead to that more frequent skin irritation and breakdown. I will say it's okay to use them in moderation. So let's say you bring a pack with you in your purse when you're leaving the house. If you're someone that does have to deal with incontinence, or also if you like post-run or workout feel like that odor is bothersome, just try to avoid using them constantly and only when absolutely necessary, to once again maintain that pH balance of the vulvar tissue and prevent that breakdown of the skin. Some products that I recommend if you're going to use the wipes include the Equate baby clean everyday wipes, the lady groomer wipes, Pure Touch, large up and up cleaning washcloths can also be used at home and on the go. And just to reiterate, you don't want to be cleaning the vagina itself. So once again, the vagina is going to be the internal portion. What we see from the outside, we see the introitus, the opening. So you want to avoid that, as well as anything internal. If you must water, that's okay. But this is where we really get into an increased risk for BV or bacterial vaginosis, as well as any products that do throw off the pH of the vaginal canal can lead to other issues like yeast infections and itchiness. If you're allergic, you don't want to mess with the internal portion there, so try to avoid that as much as possible, which may be contradictory to what you were taught by family members or school, but definitely remember that the vagina is a self-cleansing oven, so we don't need to do that. Hopefully this was helpful. I will link some of my recommended products in the description. Let me know if you have any other questions regarding hygiene of the vulva and vagina. Otherwise, I look forward to the next video. Thank you all for watching. And side note, I passed my board exam, so I'm officially going to start practicing in a clinic very soon. So I'm excited to share updates. Thank you guys. Bye. And don't forget to subscribe.